Hello friends, I am Dr. Rajiv Balan, Paediatrician and Newborn Specialist from Andheri East, JB Nagar. I am here to discuss regarding a few concerns about this pandemic situation, especially among parents, regarding how to manage their children. So one of the most common concerns which I get from parents is how to manage their children during this pandemic. How to recognize signs and symptoms whether they are suffering from illness or not. How do they take care of their children if they get infected or if they are in contact with anyone who is COVID-19 positive? Are there any medicines to prevent this disease in children? Are there any diets or supplements to increase the immunity which would prevent the illness, or any specific treatment for this illness? So, coming to the most common part where the parents ask, what is the most common sign and symptom? How do you recognize COVID-19 in my child? So, regarding this, I'll tell a few aspects. So, in children, you must especially remember that COVID-19 can have varying symptoms depending on which system they affect or a generalized symptom. So children can present with vague symptoms like body ache, headache, myalgia, fever, vomiting, loose motions, or severe dehydration if the virus affects the gastrointestinal tract. Suppose it affects the respiratory tract, they can have nasal discharge, coughing, dry intermittent cough, or increased respiratory rate. In a very young children, they can have symptoms such as decreased feeding, lethargy, or not able to latch on properly, cyanosis, bluish discoloration of hands and feet. In older children, they can have varying symptoms like apart from which I told you, myalgia, fever and headache, loss of taste and smell, especially if the child is more than 8 years of age. A child can also present with a generalized rash or even conjunctival congestion or ulcerations, mucositis and stomatitis. But we must remember, one of the most common symptoms in children are asymptomatic. They don't have any symptoms, especially if they are only in contact with the COVID-19 patient. Rarely, but you must remember that a child who may have fever in the first 1 or 2, 3 days, then it gets better, but suddenly in the end of second week, after 2 weeks, he may develop a sudden onset of rash, increased respiratory rate, features of shock like decreased pulses, decreased urine output, going into respiratory failure, cardiogenic failure. These are severe symptoms of MIS, which you call, that is inflammatory response to COVID-19, but this is very rare, but you must keep in mind. Now, coming to the part where how do you manage such children? Just little bit I will let you share information that basically parents should remember that you must prevent by basically what is the spread of COVID-19 mainly. What current evidence suggests, it is mainly to droplets by either nose or what we speak. So wearing mask at all times. So even if one of the parents is infected, make sure that you wear your mask properly. And other thing is, you must wear your hand wash properly. So that is the most common preventive aspects you must remember in children. And always, whenever the child is having any symptoms, make sure that you consult the doctor and have at least symptomatic treatment for them. There are no specific medicines to prevent it, to boost the immunity or to prevent or to any specific diet. Okay, thank you.